I can't hear myself. Wait a minute. Why can't I hear myself? Oh, I know why. Okay. Sorry, I couldn't hear myself. Oh my God. Hold on just a minute. Oh my God. Oh my God. Oh my God. Good morning. Good morning. Good morning. Car in the shop, so I'll be in and out. Car's in the shop, so I'll be in and out. All right, Lee, my darling. I hope everything goes well with the car. Oh, God, I hope. God, I hate car shit. I hate it. I just hate it. I'm already there. Yep, badge. Oh, my God. I'm just like hiccuping. Good morning, Dan, Michael, Badger. Grace Lisa. How are you? Good to see you. Good morning, everybody. Happy Friday. Woo, woo, woo. It's Friday. It's Friday. It's Friday. Spin. Oh, my God. You're still alive? That's fantastic. Spinnaker's here. I'm so good to see you. It's paid for and low miles and keeping it on the road as long as possible. Hell to the yeah, girl. Hell to the yeah. Teresa! Why you have to be such a wonderful girl? Teresa. Well, I've had some sugar this morning. I had my brown sugar oat milk latte because I thought, oh boy. Actually, I just happened to be driving by a Starbucks and I thought, fuck it, I need some coffee and I'm not gonna have time to make any. Hello, Paul J. Hello, good morning. Good morning, sunshine. Sharon Brown, good morning, my darling. Oh, it's still on? Oh, okay. Is it really? Weird, I thought I turned it off. Okay, well, that's cool. I guess. Oh, there it is. Oh, well, there you go. Thank you. Because for some reason it doesn't play in my ear, but that's okay. TGIF, family. Thank you, Neil. Or thank you, Lee. Thank you, my darling, for telling me that. Good morning, everyone. Welcome to Wake and Bake with Lolo. I'm Lolo. This is Wake and Bake. And this is your national nightmare. Good morning. I am your national nightmare. No. You want to know what the national nightmare is? Let me tell you what the national nightmare is. My nose is running because it's so upset. I was listening to NPR again this morning. Huge mistake. Yeah. I just need to stop listening to news. Of course, happy to have made it to another Friday with all of you. Oh my gosh, indeed, my friend. Oh my goodness. I'm so excited. I'm not going to say, but I'm very excited about certain things that are going to happen this spring. That's all I'm going to say about it. Anyway, good morning, good Friday, happy Friday. I love you too, Teresa. The donut holes are medicinal. Oh, fuck yeah. I mean, donut holes work. Yeah, they make it work. And so this has brown sugar, oat milk. Oh God, it's just so good. I hate it. Yes, it is the National Money Drive week, but they still say some stories between their asks, which is fine. As an old fundraiser, I have a soft spot in my heart for the annual drive. I understand what they're up against. It sucks. It sucks to raise money. Raising money is one of the worst jobs in the planet, frankly. I'm not going to lie. It's one of the worst jobs on the planet. But as long as you believe in what you're doing, it's probably better. Anyway, this morning, gosh, so I was listening to NPR. I was riding around. I dropped Bobo off at work, and they were talking about this thing called the federal earnings test or something like that. I think federal earnings test. I don't know why. Why is my nose running? I don't know. I shouldn't have done all that coke in the 80s. Sorry to blow my nose on. Oh, hi, I saw you with the eyes. I thought it was clever with the eyes. Anyway, so I was this federal earnings test, I think. I want to see if I can find the story. And it's about universities that receive money for, like, it's probably spring sniffles. I am having a bit of an allergy attack this spring. It's not helping very much. But this federal earnings test, the White House is discussing, or I guess they're going to do it. I don't really know how far down the road it is. But they want to do a test of, in 2 years, can you as a university prove that your degree programs result in more earnings for graduates than if they had just graduated high school? And if they don't pass that test, then they don't get, like, Pell Grant money. So make this make sense for me. You're going to tell me that you're going to withhold grant money for low-income students from universities if they don't prove that their graduates make more than a high school graduate. And I know it's a little more complicated than the way I'm describing it, but essentially that's the test. And it sounds like there are states that are actually already, like, taking the initiative to do something like this. And as one of the folks on the radio were saying this morning, it's like higher education isn't just about earnings. It isn't about earnings, actually. Earnings is not and should not be the test of whether or not an education is worthwhile, I guess. Is that what we're talking about? The worthwhileness of education? And, you know, I can also complain about the state of higher education and say that it is too exclusive, it is too expensive, it is too unattainable. But I also know that I don't have a master's degree. I got a undergrad degree, and then I went straight to work, right? And then later in life, I was able to attend because I won a spot in this Stanford program for nonprofit leaders to go through some of their graduate level B school courses, right? And so I was exposed to what true higher education, where you're like, you know, master's level classes. I got exposed to that. And I'm going to be honest with you. I've always been the person that's like, I don't need a master's degree. I'm, you know, because I didn't have one. So that's why I was like, I don't need one. But the experience of being in that environment and thinking through problems at that level did give me different perspectives of what that just expanded my horizons, right? And that was, you know, that was what, 2011? So I was already almost 20 years into my career. I wasn't like new in my career. I was pretty, you know, pretty old. But I really learned a lot just about higher level thinking, I guess is the way I'd describe it. I don't know how to really describe it. I'm not trying to say that it's like better thinking, but there's like a different level of complexity that just came into that environment for me. And so what I can appreciate is that what people get out of education isn't a tit for tat. It isn't a quid pro quo. It is literally the enrichment of your life to think differently, to learn about new cultures, to learn about new things, to change your mind about the way problems could be solved. I mean, there's a million doors that are opened when you allow people to sit in that space and have those conversations. I don't think there are other metrics. I mean, I want to look at this. Hold on. Let me see if I can find. Earnings test. Yeah, here we go. Okay, well let me entertain you. Let me show you. Oops. Do you know the Muffin Man who lives on Drury Lane? Do you know the Muffin Man who lives on Drury Lane? Sorry. Okay, anyways. Well, this is senior. What is this? What is this? Who is this? WASC. I have no idea what you are. Senior College and University Commission. I have no idea. Okay. Okay, here we go. This is what is being discussed. Wait, let me check here. Yes, power, fears, and educated populace. This is actually right in the authoritarian playbook. Is keep people dumb. Keep people uneducated, keep people isolated, keep them in a pipeline, right? Put them into whatever you need, machinery, whatever. And so this is exactly, yeah, No Child Gets an Education. That's exactly what No Child Left Behind was. Yeah, No Child Gets it. Learning to think is pretty valuable. I think it is. I think it really changed my life. Yeah, he wants to turn U.S. universities into trade schools. Yeah. And there is a desire to, not fund universities where they have certain types of majors or something. I can't remember. I have to read about it. But so let's read this, because this, I think, captures what I'm talking about, but we'll see. Okay. Oh, okay. So really what they're doing is they're not taking money away from colleges. They're taking money away from students. I get it. Okay. The U.S. Department of Education's Accountability in Higher Education and Access through Demand-Driven Workforce, Pell, AHEAD, negotiated rulemaking committee reached consensus this month. Who are they? Who the hell is this committee? On proposed regulations that would create a new earnings accountability test for all post-secondary programs. The regulations are anticipated to take effect by July 1st, 2026, following a public comment period. Oh, well, strap in, kids. Because this time we're not going to miss it. I hope we didn't miss it. We might have missed it. Under the proposed regulations, graduates of undergraduate programs... I need to move this over here so I can see it. Under the proposed regulations, graduate of undergraduate programs would be required to earn more than individuals aged 25 to 34 with a high school diploma, and students who complete graduate programs would need to earn more than individuals 25 to 34 with a bachelor's degree. Students enrolled in degree and certificate programs that fail this earnings test in 2 out of 3 consecutive years may lose access to federal direct loans. What? I dropped out of my undergrad in music, so as I had a career well on its way, I told my kid not to go into music. Guess what she's majoring in? Hey, man, you can't stop talent. That's it. Additionally, institutions would be required to demonstrate that at least half of their Title IV recipients and at least half of their total Title IV funds are not associated with programs that fail the earnings test in 2 of 3 consecutive years. Students enrolled at institutions that do not meet this requirement twice within could lose all access to federal student aid. Yeah. If a program fails the test for 2 consecutive years, an additional test will determine if 50% of the institution's Title IV aid recipients are enrolled in, or 50% of the institution's Title IV revenue came from programs deemed low earnings by artists. If either threshold is met, students in the affected programs may lose access. Students! I can't even believe this. Institutions would be required to begin reporting program and student level data by October 1st, 2026. I'm going to tell you one thing about education data. It's fucked up. It's hard to get. And annually thereafter, ED would then calculate the earnings test and notify institutions in early 2027, 2028. The proposed timeline, July 1st, 2028, is the earliest a program could lose access to federal student loans. We got to get rid of this fucking regime. I'm going to tell you right now. There's nothing healthy about what this regime is doing. Nothing. Additional information, blah, 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 blah. Wait, After a public, well, when was the public period? That's what I want to know. Public comment. Oh my God. Comments on the proposed rule are accepted through April 8th. April 8th. How are we supposed to keep up with all this? How are we supposed to keep up with all this? This isn't fair, okay? I'm sorry. This isn't fair and I hate it. How am I supposed to? I can't keep up with all this. God damn it. I could do a whole full-time job just looking at the Federal Register. I can't. I'm so depressed. I can't even tell you. You know, not only is my life shitty because I'm alone, we don't have a great place to live, and life is just really crappy right now, but then we have all this. Yeah, I don't think 40 hours would be enough. I just don't even know how to keep track of it. Like, I'm losing my marbles. I mean, I guess I'm going to build in a bunch of alerts for Federal Register shit, but it's like, fuck, man, how are you supposed to actually participate? Oh, my God. On March 9th, they gave a month, which, you know, is whatever. This really pisses me off. Aaron Washington, Office of Post-Secondary Education. Great, I'm going to call him. Hold on. Hold on, everybody. (202). What's his number? 987. Aaron?
Aaron Washington.
Hi, is this Aaron?
Yes, correct.
Oh, hi, Aaron. My name is Lolo, and I am a citizen. And so, sorry to bug you during your day, but I just wanted to call because I'm actually live on my silly little YouTube channel. But don't worry, there's only like 20 people here. And my question is, I see in the Federal Register that the closure for the AHEAD Act, or whatever that higher education rule change that's going to take place, that the comment period just ended on April 8th?
Are you a reporter?
Kind of. I'm a voter. Yeah.
Yeah. If you have a press inquiry, or if you would like an official statement.
No, I don't have a press inquiry. I'm a citizen. I'm a citizen. I'm just letting you know that I'm online. That's all. But I'm just being kind. But I just wanted to say, because this rule where you're literally taking away, or not you, but people are taking away Pell Grants and things for low-income students. I mean, I ran a high school in Brooklyn. You can't just take money away from kids because they're not their degree isn't going to earn enough. That's the most ridiculous authoritarian thing I've ever heard of. Right? Doesn't that make sense to you? What, did you have a Pell Grant when you were going to college?
Yeah, if you have a press inquiry, you can email press@ed.gov. If you'd like
you know what, Aaron, I have advice for you, my darling. You need to quit. You need to quit. Unless you're going to stand up for students and stand up for democracy, you need to walk out that door and say, I'm not doing this. I'm not supporting this regime. So no, Aaron, I don't have a press inquiry. I have a human inquiry. So do a better job and find, maybe you should work in education, like actual education, not destroying education. I'm sorry, Aaron, but this is what you signed up for. So let's be real. Did you come in with the new regime, or have you been a career?
All of our regulations have a public comment period. So if you are interested in commenting on a rule, you can submit an official comment to the public comment period. But
right. But otherwise,
that's the official way to submit a
right. Yeah. Okay. All right. No problem. Did you get a Pell Grant when you were going to college? Did you get grants? Did you get any financial aid, loans? I did. I had a lot of student loans. Yeah.
Yeah, thank you for giving me a call. The official way to submit a public comment is
Aaron, come on. Be a human. Aaron, stop it. Stop it. Be a human. Come on now. We can do hard things. But you got to have these hard conversations, Aaron. Otherwise, life isn't it's not just one swimming, you get to make sweeping changes and then move along with your day. That's not the way it goes. So, have a great day, Aaron. I will make sure I submit my public comments, and I really hope you reflect on this conversation. Thank you.
You have a wonderful day.
You too. Okay. Well, that was Aaron. That was Aaron. He did handle it well. I mean, well for a Nazi. I'm sorry. Hey, man. I don't make the rules. Aaron is being a coward. Yeah, even if it's just in refusal to stand up to the regime. I mean, he's not going to... Well, actually, you know what? I don't know what he's able to say and what he's not able to say. I don't know Aaron's heart. But, I'm just going to say, like, this is, there's no, you can't hold back, okay? If you need to say something about what this regime is doing, just fucking say it, okay? Just say it. Because there's no time to hold back. There's no time to hold back, right? And Aaron might, I don't know, maybe Aaron's going to think about it. Maybe Aaron agrees with me and he can't say anything, but he's going to feel like, oh my God, there are people out there that feel like I do. Okay, so maybe that's the case. Yeah, he can say anything he wants. But, he thinks, I was just trying to be nice saying I am online. So, Aaron, don't tell me your darkest secrets because we're online. Anyway, well, there you go then. There you go. All right, well, we made some feelings known, but I don't know if Aaron's going to take our feelings anyway. I don't think he's going to care. Oh, my God. Poor Aaron. Or his job, yeah. Yeah. Oh, my God. I don't know. Yeah, to whom am I speaking? If you're working for fascists, losing your job, speaking out against them is the courageous. And listen, I'm not trying to get between anybody and their paycheck, okay? But I have also been fired from jobs and made stinks at job, which caused me to get fired when I was unhappy with the job and the way it was being run, okay? I spoke out. I got fired before I could quit, okay? So I'm going to say it's okay to speak up when you're at your fucking job. Okay, because I lost an entire career and I had 6 weeks of money to find a fucking job when I got fired. So let me tell you something. I know what it is to stand up to your work. I know what it means. I paid a motherfucking price for it. So don't tell me that you don't have the kahunas to do it. Fuck you. Find them. Grow them. Yes, in the alternative, many civil servants are doing their best to maintain institutions and institutional knowledge, the loss of which have all been deplored. Yes, of course. Of course I understand that, Oomph. Of course. Of course I understand that. So I hope Aaron is that person and that he's just standing in the breach. But I don't know that. And so either I pissed him off or I made him feel like, oh my God, there's people out there who agree with what I think. And even though I can't say it, you know, blah, blah, blah. So anyway, I get it, but I don't know. That breach is pretty wide. It's pretty hard to stand in that breach. I don't know. All right. Well, anyway, that's that. That's the story on what I was thinking this morning. What I thought about this morning. I'm also a terrible customer service representative. I'm like the worst possible customer service person you could ever imagine. Because I used to run customer service for a large brokerage firm. And so I know how to be a terrible customer. It's a terrible thing. I'm just tired of giving people acting cowardly in public the benefit of the doubt. Well, I mean, you know, at what point? I don't know. I mean, I understand both sides. I understand that people are just trying to do the best they can. I also understand that they need to know that it's just not, that's not the way the rest of the world is not going along with what is going on in your lives. Guess what? We are not happy with the way that your bosses are running your company. And guess what, Aaron? You put your fucking name on the fucking thing. So sorry, Aaron, but you're the bitch that gets to take the call. No, he didn't. Oh my God. We're going to start in the standing up for Aaron. I think Aaron gets calls like mine all the time. Refusing to make any statements, yeah. Anyway, whatever. I don't know. He could have made a joke, and then I would have known. Whenever I'm on a bad customer service call, I pretend I can't hear them hang up, call back, and hope I get someone better. Gal, I think Lolo needs a dedicated show where she calls the Institutes of Mass Destruction and tells them what's what. I would do that too. I would do that. Oh no. You know, I mean, I understand what you're saying. Aaron tried to be just kind and follow his script and be professional, and he was professional, and I appreciate that, Aaron. I appreciate you being so gentle. But we've got to do better, and that's Aaron's got to know. And if Aaron doesn't want to get those calls, then Aaron should ask his boss to put somebody else's phone number on there. That's what I think. I know, I'm such a bitch. I will. I'll call all of them. Are you kidding? I should call them and ask them for a call. Oh my God. Let's do it. Wait. We're going to do something here. What's the college that John Eastman? What's the college John Eastman was at? Wait. Oh, fuck. Well, I can't even. John Eastman's college. What is that college? Shit, man. What's his college? What's the college he's at? Come on, guys. John Eastman. What did he work at? John Eastman. It's in California. Friday fun. Phone fun. Employer. I don't know. Is it an employer? I mean, is it? Oh, Chapman. It's Chapman? I think Chapman is who I'm thinking of. I'm thinking of Chapman. Isn't that the really weird university? Of course, I have to leave when the... Oh, Lee. Well, Chapman College. This is great. This is great. Is that where he works? Did he work there? Did he work there? Chapman, okay.
Thank you for calling Chapman University. We are located at 1 University Drive in Orange, California, 92866.
Yeah, we know.
You may also visit our website at www.chapman.edu.
Right.
Our regular business hours are Monday through Friday from 8 a.m. to 5 p.m. Pacific time. Please listen carefully to the following, as our menu options have changed.
No,
To search
he's
for
Chapman.
people, departments, or offices,
No, he doesn't
please
work
visit
there anymore. I have an idea. Don't worry. Stay with me. I have an
To send us a
idea.
message, visit chapman.edu/contact. Or to leave a voicemail message for a callback, press 0. For public safety, press 1.
Okay, here we go.
For the offices of admission and financial aid, press 2. For employment verification, press 3. For academic records and the registrar's office, press 4. For current students, press 5. For all parents, press 6. For a complete list of schools and colleges, press 7.
What?
For Leatherby Libraries, press 8. For events and attractions, press 9. To leave a voicemail, press 0. Otherwise,
I was going to press a number. I was pressing a
For the
number.
registrar's office,
Okay, this is
please
great.
press 1. For student business services and to-in payments, please press 2. For financial aid, please press 3. For residence life, please press 3. For residence life, please press 4. For counseling services, please press 5. For Leatherby Libraries, please press 6. For
I'm just going to go to the registrar. I need the press office.
Thank you for calling the office of the University Registrar at Chapman University. Please select from the following main menu options. To obtain your username or password for my.chapman.edu, please press 1. For information on transcripts, please visit our website at www.chapman.edu/transcripts
I just want to talk to someone.
or press 2. For questions regarding verification and loan deferments, please press 3.
I don't know.
For questions regarding registration, program evaluations,
Okay,
or
great.
to speak to an
Oh, I want to speak to... Okay, great. Good morning, loungers. We're calling Chapman University. Oh, yeah. That's right.
Registrar's office, how may I help you?
Hi, I'm actually calling, is there anywhere like the dean's office or some kind of administrative office that I could speak to? I'm so sorry. I don't know who to dial.
Yes, can I know what this is regarding?
I wanted to get a comment on a news story, about, I'm actually just a citizen, but I wanted to get a comment on a news story about one of their former employees.
Oh, okay. Let me see.
Not bad stuff, just like a question. Or not personal either. Yeah.
One second. Okay, I could go ahead and, if you like, I could give you the senior vice president for student affairs and dean of students number.
That's great. Thank you.
Okay. So that would be Jerry Price. And when you're ready, I could provide you with the number.
Okay, hold on just a second. Okay, go ahead.
714 997 6721.
Wonderful. All right. Thank you so much. I appreciate it.
You're welcome.
Bye. Okay. Let's see. 714 997 6721. Here we go. All right, get ready. Oops.
Good morning, Dean's office. This is Aruni.
Hello. I'm calling to get a comment from the dean's office about the disbarment of John Eastman, and if any comment that the university has on his disbarment and participation in a potential coup. So I was just wondering if anyone could comment on that.
As far as I know, he's no longer with Chapman for a while now.
Yeah.
I happy to let the dean know that you called, but I can't comment on anything personally.
Yeah,
But,
understand. No problem.
yeah.
Yeah. Okay, well, yeah, if you could
Okay.
let the dean know that people are calling and curious about their response about John Eastman, who helped plan the coup on January 6th, if we could just understand how the university feels about supporting a man who has been disbarred by the state of California. So that's all. If you could pass that message along, that would be wonderful. I really appreciate it. Thank you.
No problem. I'll let him know.
All righty. All right. Thanks so
Thank you.
much. Bye.
Bye-bye.
Okay, I think that's enough people's lives ruined for this morning. Damn it, we couldn't talk to the dean, but that's okay. Let's call Yale. Yeah. I'm going to call a bunch of people. Why'd you give this person a degree? Hey, man, I just want people to know. We're waking and I know I need some baking. I don't know what's going on with my nose, but anyway. Well, that was fun. That was fun. Thank you for indulging my childish nature of wanting to put people on the spot. Have you liked this stream yet? That's right. Make sure you hit the like, y'all. Chat my ass. He doesn't work there anymore. I know that. He doesn't work anywhere because he's been disbarred. Hello, Harvard. Yeah, how come you jerks folded so fast? I might start doing that. Maybe I'll just become that annoying woman that calls places and poor receptionists are like, stop calling us. We have nothing to do with this. Hi, Griffey. How you doing? Oh my God. This is too much. I want to hire you for anything. Oh, no, you don't. Actually, you don't. I'm a terrible flake. Okay, let's see. All right. So this was, I know. It's Bobby Brainworm. No, I'm not going to do the Brainworm voice again. I'm sorry, but he's in front of the Senate this morning, I think. And so I wanted to take a look. Disbarment does not seem to harm these assholes' earning power. Yeah, exactly. God damn. I just want to remind them that they're associated with a fucking asshole. I can guarantee you the Dean of Chapman does not give one flying fuck what Lolo thinks. And that's fine. I'm used to that. I'm used to that. Absolutely. You sound so friendly on the phone. You could probably get past. Oh, I can. Oh, Josh. When I turn it on, baby. Oh, I can get blood from a stone, babe. Trust and believe. I know exactly how to be on the phone. I know how to do those phone calls. Okay, so we're going to watch a little bit so I can smoke some weed. We're going to watch a little bit of something that happened this morning. I hope everybody didn't watch it already, which I can't imagine you would, because why? But good old RFK Jr. and his brainworm were on the stand again this morning. Singing for their supper. And this is the Education Workforce Committee. I'm not even sure what that means, but anyway. Here we go. Let's do this. I need to smoke. That's too much human interaction for me already.
Healthcare is a critical part of the equation. Yet for too many families, the cost of care continues to rise while transparency remains out of reach. Patients and employers are too often left in the dark, unable to make informed choices about price and quality. That's unacceptable. Americans deserve clear and upfront pricing that will help drive competition and lower costs. This committee remains focused on strengthening transparency and ensuring the system works for patients, not against them. And we're glad to have the partnership of this HHS to help accomplish those goals. But access to health care is only one piece of the puzzle. Health begins long before a patient enters a doctor's office. It starts with nutrition, prevention, and daily choices.
I agree,
Under Secretary Kennedy's leadership,
I actually don't like
HHS has
talking to
righted
people.
the food pyramid and delivered scientifically sound dietary guidelines for Americans. These are critical steps toward building a stronger foundation for public health, particularly for children. This is also an era where the committee has led. We restored access to healthy, full-fat dairy in federal child nutrition programs, ensuring children receive the minimum they need to grow and thrive. Health is also shaped by environments in which we live.
I'm going ahead, Wahlberg. You're an idiot. Whole milk actually is not. That is from the dairy industry. The dairy industry are the ones who wanted full milk. Okay? So this is like a lobbyist got their way. It isn't,
Parents trying to raise healthy children.
God damn it.
level. You have to embrace the
Why are
health
they
and
so
well-being
low?
of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. This mission is why many get involved in public service in the first place. This is in part why the President's words the other day were so shocking. As President Trump said,
It does look
you
like
can
her.
see over my shoulder, we're fighting wars. It's not possible for us to take care of daycare, Medicaid, Medicare, all these individual things. They can do it on a state basis. You can't do it on a federal level. You have to take care of one thing, military protection. And regrettably, the proposed budget that you're here to defend today reflects that sentiment. Overall, the White House's proposed budget reduces HHS discretionary budget authority by about $15.8 billion, or 12.5%. If these proposed cuts are enacted, they will have devastating consequences for Americans' health and well-being, and will raise costs for America's families.
I thought that too. I'm like, Mark
Take
Wahlberg
Americans'
runs this
healthcare,
committee?
for example, the proposed budget cuts target public health agencies such as the Center for Disease Control and Prevention and the National Institutes for Health, weakening the systems that communities rely on to prevent disease and respond to crisis. Additionally, thanks to the cuts from H.R. 1, or what we refer to as the Big Ugly Bill, policies of this administration, Americans are now paying more to see a doctor and to fill prescriptions. Americans should not have to go into debt
Happy
just in order to
Friday.
stay healthy. The department should be focusing on ensuring affordable, accessible health coverage for as many people as possible. Regrettably, when fully implemented, the actions taken by this Congress and administration will reduce the number of people insured by about 15 million. And as a direct result of this administration's policies and priorities, the cost of living has become increasingly unaffordable. Moreover, the President has recklessly gotten us into another war in the Middle East, causing energy prices to skyrocket. And as those energy prices skyrocket, your budget would eliminate the Low-Income Home Energy Assistance Program, LIHEAP, which helps millions of families stay warm in the winter and cool in the summer, reducing the risk of health and safety problems arising from unsafe heating and cooling situations. Similarly, American families are struggling to find safe, affordable child care. And Trudeau's word that it is not possible for us to take care of daycare, the President's budget proposes flat funding, both Head Start and the Child Care Development
Fucking
Block Grant,
babies.
even though current funding levels serve only a small fraction of eligible children. And when adjusted for inflation, flat funding would likely result in fewer children actually served. In addition, the President's budget would completely eliminate the Preschool Development Grant, which helps states improve the quality and safety of child care programs and ensures all children can arrive at kindergarten ready to succeed. Last year, HHS illegally withheld funds from Head Start facilities nationwide, pushing many Head Start programs to the brink.
Pepper,
And earlier
yes,
this
thank
year,
you.
HHS froze over $10 billion in congressionally appropriated funds for 5 Democratic-led states, which also impacted child care development funds and the Temporary Assistance for Needy Families, TANF. These actions were not without victims. Many child care providers and grantees are already operating on shoestring budgets. And without federal support, child care centers may have to close. And when they do, the parents are left in the lurch without access to child care. In times like these, the social safety net programs provide struggling families a lifeline. Or these programs have either been taken away or scaled back under your leadership. Cutting these programs doesn't make the cost of child care, food, or health go away. It only shifts the burden onto the households that can least afford them. Lastly, I want to address the growing concerns of Americans with disabilities who have been acutely impacted by your department's policies and priorities. Last year, you targeted the Administration for Community Living, an office that houses several key programs for people with disabilities as well as seniors. The loss of ACL would not merely be a bureaucratic shift. Its proposed elimination sent a clear message that the rights and safety of people with disabilities and older adults were no longer a priority for HHS. After more than 50 years of bipartisan progress towards independent living and equal opportunity, the proposed dismantling of ACL takes this country backwards. Last August, I released a report detailing how the administration has undermined programs such as Centers for Independent Living and Assisted Technology. Moreover, the Big Ugly Bill's deep cuts to Medicaid will inevitably reduce home and community-based services, the very support that allows people with disabilities to live independently. I'd like to ask unanimous consent to enter that report into the record.
Without objection. Objection and hearing none, it will be entered.
Thank you. Additionally, your proposed budget eliminated the chronic disease self-management education and fall prevention programs, effective programs that seniors across the country have come to rely on. When services are cut, families face impossible choices, people risk losing their independence, and so I ask you to reconsider your position and recommit to fully supporting people with disabilities and older Americans. So, Mr. Secretary, I want today's discussion to focus on how we can actually fulfill HHS's mission and your commitment as citizens, and our commitment as citizens to care for one another. Regrettably, I fear that this budget proposal will not serve that goal. Thank you, and I yield back.
I thank the gentleman. Pursuant to Committee Rule 8C, all members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5 p.m. 14 days after this hearing. And without objection, the hearing record will remain open for 14 days to allow such statements and other extraneous material noted during the hearing to be submitted for the official hearing record. I'll now turn to the introduction of today's witness, the Honorable Robert F. Kennedy, Jr., Secretary of the U.S. Department of Health and Human Services. Mr. Secretary, we are grateful to have you here today. Thank you so much. As you're aware, it's your responsibility to provide accurate information to the committee. Pursuant to committee rules, I would ask that you
thank you.
And the teacher wouldn't have to turn it off. And I think that will be the case today. But
it will be refreshing, Chairman.
It'll be firm and it'll be strong, but I trust it'll continue to be respectful. I'll now recognize myself for 5 minutes of questioning. There is a burning question in inquiring minds, as I understand it, to hear you answer the question as to whether you're responsible for the measles outbreak. So let me ask that question.
Thank you, Mr. Chairman. And I've been accused of that. The accusation is not science-based. The measles outbreak began in January 2025 before I took office. Now, almost 90% of the people affected are over 5 years old, so they made the decision not to their decision to not vaccinate predated my occupation of this seat. We've done better. The measles outbreak is not an American phenomenon. It is global. It's happening all over the world. And we've done better under my leadership than any country in the world in limiting it. Last year, we had approximately 2,200 cases. Mexico had more than 3 times that number. And they have...
Okay. So he's first of all, not going to take responsibility for his position on measles vaccine or childhood vaccines in general. Okay? So he's going to escape all responsibility about what he talked about in the wake of learning. In the wake of learning about the measles outbreak, what did he do? He talked about the fact that he brought attention to the fact that the vaccine was questionable. Blah, blah, blah. That started that whole thing. So this wrinkled foreskin in a suit and a skinny tie, which is so fucking Kennedy and Nantucket bullshit, is gonna take zero responsibility for all of the shit that he's pushed into the public health system. And the fact that, and Wahlberg could sit there and make a joke about it, like, did you start the measles outbreak? Well, tell that to the parents of the dead children, Mr. Wahlberg. Well, it strikes me as somebody who lived in Boston, it strikes me as a New England kind of vibe. But, I mean, it could just be my recollection of New England. But that's my recollection. It's got like little sharks or a plane or something on it. I don't even know what it has on it. Anyway, point is that they're making jokes about something that is incredibly serious, about the fact that we had a measles outbreak. Yeah, whatever. I don't care. Who cares, Pep? Who cares? Who cares? Yeah, they're Martha's Vineyard, whatever. I don't care. They're assholes. Yeah, he swims in sewer runoff. Yeah, no, yeah. He does so much. There's a brain. Oh, that's the brainworm print. Thank you, Spin. That's the brainworm. Nantucket Vineyard, whatever. It's all the same. And this is a great shot of him. I thought the skinny tie was an old jazz thing. I don't think so. I don't know. I guess we all have a different interpretation of skinny ties. I mean, I also remember them from the ska movement in the 90s, or, part of what I was exposed to. My people are Nantucket people, so it's just a me thing. No, Pepper, I understand. It's like, don't put those people in Nantucket, God damn it. That's right. Oh my God. Sorry, Pepper. I won't make that mistake. I will actually be a little more precise with my language on that. But also the fact that he's now saying, but look at Mexico. Theirs is 3 times. Does Mexico have an equitable public health system to ours? I actually don't know the answer to that question. They may indeed have as robust a public health thing as we supposed to have. I don't know. We don't have it anymore, but I just don't know. And so, I mean, I don't know what vaccine rates are in Mexico. I have no idea what any of that stuff is. But my God, he's looking at another country and saying, well, look at them. They're like 3 times what we are. Well, let's talk about what we were before you came into office. I don't know.
Of 1/3 of our population. Canada had double that number, and they have 1/8 of our population. Europe had almost 10 times that number, and they only have double of our population. Many other countries have lost their elimination status. Canada lost it. Britain lost it. These are countries I haven't visited in years. Many European countries have lost it, Austria and others. I want to say something because 2 little girls died tragically in the Mennonite community in Texas. The Mennonites have not vaccinated since 1796. Oh, this has nothing to do with me. I went to the funeral of one of those little girls, and I spent a day with the family of the other. And both of them told me that when they took their children to the hospital, they were treated as pariahs. They were shamed. They were not given proper treatments. President Trump believes that they
committee for his entire 6
administration is to get us back to a 1-to-1 ratio. And we have sent out letters to all the states to end that policy.
Hi, Tom.
Thank you. My time has expired. I now recognize the gentleman from Connecticut, Mr. Courtney.
Thank you, Mr. Chairman. Mr. Secretary, after 14 months on the job, your long overdue appearance before this committee is particularly pertinent given the fact that your uncle, John F. Kennedy, served on this committee for his entire 6 years as a House member representing the 11th District of Massachusetts. As his National Archive bio states, as a House member, he advocated expanding health care for all. And as president in 1961, he supported passage of Medicare legislation, the King-Anderson bill, which was ultimately enacted in 1965 by his successor. That transformational federal law provided universal insurance for seniors at a time when only 50% could afford health insurance. And over time, it has vastly improved the health and life expectancy of our nation. Your other uncle, Senator Ted Kennedy, who I'm proud to say campaigned for me when I was first elected to Congress by a whopping margin of 83 votes, declared, quote, universal health care is the cause of my life, and was lead sponsor of the Affordable Care Act when it was introduced in 2009. He did not live to see its enactment, but we know now that the ACA successfully cut the uninsured rate in half by 2024 prior to your arrival at HHS. Clearly, universal health care is not the cause of your life. On your watch at HHS, we've seen a massive jump in the uninsured population. Since January 2025, 1.2 million have already lost coverage thanks to the Trump administration's refusal to extend the ACA enhanced tax credits, even though we passed a bipartisan bill in the House to do so. A couple of days ago, the Wall Street Journal reported that 1.2 million number is going to continue to grow because 14% of new enrollees this year didn't make their first payments for the new Trump premiums. As the Journal reported, this will add millions more to the ranks of the uninsured. Even worse, with the passage of the misnamed One Big Beautiful Bill, CBO reports another 10 million at least will lose their coverage as states are forced to implement the largest cut to Medicaid in American history. According to Gallup 2 weeks ago, the affordability of health coverage has now jumped to the top domestic policy concern facing Americans, which is pretty striking given the fact that the cost of housing, groceries, and gas to get to work has skyrocketed under this administration. But they're right to be concerned about the expense
Fuck yeah, Dan. Let's hear it from Mexico. Scheinbaum opened up by health care to all in Mexico by 2027. Fuck yeah.
Cancer and heart disease and inpatient care if needed. Slashing health insurance affordability does not make America healthy nor more economically secure. At an Easter luncheon a couple of weeks ago, Mr. Trump stated that, quote, it's not possible for the federal government to pay for Medicare and Medicaid. It's up to the states to take responsibility for those programs. As the person in charge of CMS, and after 60 years of operation as a federal program, which, by the way, your father voted for in 1965 when he was a senator from the state of New York, do you support his position that states should take over control and operation of the Medicare program?
I believe that we should save Medicaid and Medicare. They're absolutely critical programs, and President Trump has pledged to do that and is doing everything in his power to do so. There are no cuts to Medicaid. You look at the CBO, the Congressional Budget Office report.
My question, excuse me, was: do you think the states should be vested with control of the Medicare program? That's the question, because that's exactly what he said. He's your boss. Is that your position?
President Trump's position is that we should preserve Medicare.
No, by sending it to the states, that's the death knell.
Are you saying Medicaid or Medicare?
Medicare. It's right there.
President Trump's objective is to save Medicare, and we are taking...
Not by well, it will not save it by sending it to the states. That will destroy the program, and that's why it was designed the way it was 60 years ago.
I don't think there's a proposal to send it to the states.
Okay, let me ask you another question.
I don't know of that proposal, and the president has not told me about it.
Well,
the president's trying to save.
Well, for seniors and American families, they listen to what the president says, and they understand exactly what he's talking about, which is destroying the Medicare program. In your testimony, you talked about having
You cannot let me answer. You clearly don't want me to answer these questions.
Well, you actually didn't answer the question at all. You didn't talk about whether the state should be given the authority to run Medicare.
My answer has to begin with correcting a lot of the misstatements that you made in your introduction. I'm happy to do that.
Well, that's not a misstatement. That's a direct quote from your boss.
I'm telling you the president's policy is to save Medicare. That's what he's always
and giving
said.
It to the states will destroy Medicare. I yield.
Listen, this is a game, and these fucking senators and congressmen better understand how this game is played. This guy is actually pretty good at it, even though he's an idiot. Okay? And what he's saying is the president wants to save Medicare. That's his. Save Medicare is not a policy. Save Medicare is not a policy. And what the proposal is that more of the cost burden goes to the states. That's what the plan is. Okay? More of the cost burden goes to the states. And there are work requirements now so that more people have been, not are, will be, have been cut off of their benefits. I don't know why the rush to continue to cut money from people who are vulnerable and to give money to people who have enough. I don't understand this. It's so embarrassing, Grace Lisa, and it's so maddening to me that he gets to play word games. What you have to ask these assholes is very specific. Tell me about the cuts to this program. Tell me about the cuts to that program. What replaces it? Nowhere the HHS reg changes are announced except those HHS has decided are exempt from APA notice comment rulemaking. Good. Okay, great. We'll look at that. That's right. Federal Register.
Back.
I'm
Gentleman yields, and I recognize the gentlelady from North Carolina.
I'm just a nut
Virginia Fox
on the internet. That's all I am.
Thank you very much,
what the
Mr.
fuck
Chairman.
do I know?
Mr. Secretary, it's good to see you. We welcome you to the committee. I have to join the chairman, Chairman Wahlberg, in saying that the Department of Health and Human Services budget request is a breath of fresh air. Congratulations to you on presenting us with a budget that could reduce spending by $1.8 billion annually, saving taxpayer dollars at the federal level, while still providing the programs and services that reach families who need them. Under the previous secretary, the department engaged in runaway spending. So I congratulate you on what you're doing. Secretary, this committee has held 2 hearings and marked up 8 bills related to the Child Care and Development Block Grant, or CCDBG program. Federal child care assistance is a critical support for low-income working parents seeking to access child care and remain in the workforce. Therefore, child care is not only a family issue, but an economic issue. HHS awards many different grants for states in the human services space. Can you explain the urgent need to protect programs like CCDBG from waste, fraud, and abuse, especially as they are administered at the state level?
I mean, we saw during the Biden administration, my predecessor actually instructed people in my department to end program integrity. So we had 80 people in my department when Secretary Becerra came in, were assigned to do program integrity for these programs, these state programs, and he fired all but 6 of them. So that stopped. And they specifically told people in my department, don't worry about fraud, worry about enrollments. They changed the policy to a policy of our payment policy, to a pay and chase policy, so that even people women.
Recognize the gentlelady from Oregon, Ms. Bonamici.
Thank you, Mr. Chairman. Mr. Secretary, the mission of the Department of Health and Human Services starts with these words: to enhance the health and well-being of all Americans? This is a yes or no question. Does all Americans include children?
Of course.
Well, I frequently talk with families who tell me they can't find childcare, and if they can find it, they can't afford it. In fact, the childcare crisis is costing families about $134 billion in lost earnings annually. And recently, as we've heard this morning, and I'll repeat, the president said there's no money for daycare because he needs more money to fight the war, which is costing about $2 billion a day. Your department's budget flat funds childcare, which won't help at all. Yet you did spend money on a bizarre vanity video with Kid Rock. So, Secretary Kennedy, how does it enhance the health and well-being of children to spend HHS's limited resources and taxpayer money on a video of yourself drinking milk in a hot tub with Kid Rock? And how much did it cost to prepare and produce this video?
Congresswoman, I was asked to cut costs across my department because we have a $39 trillion debt.
I understand, Mr. Secretary. How much did it cost to produce this video?
I want to correct something that you said.
I'm asking how much did it cost to produce
I would have
this
no
video?
idea.
Okay, you don't have any idea. Well, I'll tell you that that money, whatever it cost, I consider waste, fraud, and abuse. And that's money that should have been invested in our nation's children and spent on something like health care and child care that actually improve people's lives. You know,
many people have come up to me who saw that video and say, that inspired me to work
Mr. Secretary,
out. That's one of the things that we want to do in this
The return on investment that we get from early childhood education shows that for every dollar we spend, we get back somewhere between $4 and $16. Secretary Kennedy, about 20 years ago, the United States eliminated measles. So we thought. But now, because of your anti-science rhetoric, vaccination rates are down, in many places below the 95% threshold needed to maintain herd immunity. And I know you said that happened before you were Secretary, but Mr. Secretary, you've been a long-time voice against vaccination for more than 20 years. Measles is highly contagious. It can make babies who may be too young to be vaccinated, so sick that they stop eating and drinking and may develop pneumonia or brain swelling. In my home state of Oregon, the Oregon Health Authority just recently warned about multiple new locations where people may have been exposed. A community college, a middle school, health clinics, grocery stores. This is unacceptable. So, Secretary Kennedy, does exposing infants and children to measles enhance their health and well-being?
I've never been anti-vaccine. I've always said I'm not anti-vaccine. Right now, I just approved 3 weeks ago $500 million for research on a new cancer vaccine.
Okay, Mr. Secretary,
you
have been a long-time voice against vaccination.
No, I haven't. No, I'm not anti-vax. I'm pro-science. What I've said is vaccines should be adequately safety tested so we know both the risks and the benefits. I'm funding a major study on developing a universal flu
reclaiming my
vaccine
time,
at NIH.
Mr. Secretary. In fact, you have said in a congressional hearing that people should not be taking medical advice from you. The problem is that they are, and they believe what you say. So, Secretary Kennedy, I have another question. Does enhancing health include mental health?
Of course.
Good. I'm glad you agree, because recently masked armed ICE agents surrounded some high school students near their school. A Latino student from Oregon, a U.S. citizen, recently spoke about he and his friends feel scared at school, have trouble focusing, and feel dehumanized. And President Trump, as you likely know, repealed the guidance that keeps ICE out of sensitive locations like schools and healthcare centers. Now, children can't understand the complexities of the U.S. immigration system, but they are scared and they can feel anxiety. So, Secretary Kennedy, does it enhance the health and well-being of children to allow immigration enforcement in and around schools and at child care centers? Does that help kids?
It was not enhancing our health and well-being of the American people to allow 20 million illegal aliens into this country. And President Trump, again, is left with a mess that he is having
Stop him.
Secretary,
Stop him.
That he is having to clean up.
In no legal or moral or ethical frame does it make sense to punish children. Young children's brains are highly influenced by
That
these
was the
stresses.
biggest humanitarian crisis in modern history, what you guys caused.
That's a good point, Why?
So if you cared about children, we have now Stop
Secretary.
97% of the unaccompanied minors from coming across the border.
Mr. Secretary, supporting
That
the health...
evinces a
True.
concern for
That
children.
none of
Mr.
this is
Secretary,
true.
I'm reclaiming my time. Supporting the health and well-being of our nation's children is the best investment we can make for the good of the country and the safety and health of American people, including children, and to truly make America healthy again. You should resign and allow someone with real qualifications to run this agency.
The gentlelady's time has expired. I now recognize the gentleman from Wisconsin.
Agree.
Mr. Grothman.
Yeah, I voted for President Trump for a lot of reasons, but one of the primary reasons was I thought he might give you this position. So
It concerns me because if they can't get this right,
of an entire and Bridge Day
For
nutrition.
giving poor kids, 63 million poor kids in this country, diabetes for free at federal expense, and treating them 78%
Okay,
of them.
you need to do the causality on that one, friend. Tell me again why that happened. Tell me about food deserts. Tell me who has the power to renovate, food options in different communities. Why don't you get them to do that? Why aren't you working on that? I know Brooke Rollins mentioned it once, but then I've never heard anything again about you guys caring about food deserts or any access to foods. And you're just speaking in such grandiose kind of like, well, 62% of poor children have diabetes because of this. What? I need more data.
End up on Medicaid, and we're treating them afterwards. We're paying.
I know this is so
The
dumb.
gentleman's time has
Half
expired.
the states, almost all red states, although 2 blue states.
Just watch. Praise be to Allah, President Donald J. Trump. An American president used the F word in a Sunday morning message that was seen by millions of people. Mr. Secretary, does this raise concerns for you about the president's mental health?
The president is a bargainer, and he knows how to make good deals.
Mr. Secretary, does this raise questions about the president's mental health to you?
Here's what I would say, that for 2 generations, every American president...
Mr. Secretary, you're
every
being
member of the
non-responsive.
Democratic Party-
Reclaiming my time, Mr. Secretary, I gather the answer. It does not raise concerns for you. 2 days later, on April 7th, President Trump put out a statement that said, quote, "A whole civilization will die tonight, never to be brought back again. I don't want that to happen, but it probably will," end quote. Mr. Secretary, the Commander-in-Chief of the United States military is calling for the eradication of an entire civilization. And 5 days later, the President started posting on Truth Social at 9 p.m. at night, continuing until 5 a.m. the next morning, and included an unhinged attack on Pope Leo, claiming Pope Leo was weak on crime. And then, later that day, the next day, President Trump posted this image of himself as Jesus Christ. Mr. Secretary, people across the country and around the world were deeply offended by this blasphemous image. Millions of Americans are questioning this president's mental fitness, his emotional stability, and whether he can carry out the duties of his office. Do you share their concerns about his mental health?
I want to call your attention to the last line of that.
Mr. Secretary, my question was, do you share their concerns about his mental health?
I want to call your attention.
Mr. Secretary, you're not being responsive. Apparently not. Reclaiming my time, Mr. Secretary. Mr. Secretary, reclaiming my time. Mr. Chairman, direct the witness. It's my time, Mr. Secretary. You're not being responsive, and apparently you don't share their concerns. We are a nation at war, Mr. Secretary. We need a commander-in-chief that we know has full command of his mental faculties and is emotionally stable as he sends uniformed American men and women into harm's way. Millions of Americans are now wondering if this president is delusional and thinks he is Jesus Christ. Mr. Secretary, given everything that I've shown you today,
Aren't they all Catholic?
will you insist that President Trump undergo an assessment of his mental fitness and his emotional stability?
Absolutely not.
Thank you, Mr. Secretary. Reclaiming my time absolutely not. I remind you that under the 25th Amendment, you have a duty to remove a president who is physically or mentally unable to discharge his responsibilities under the Constitution. It's your duty. You took an oath to the Constitution, not to President Trump. Mr. Secretary, should President Trump fail a mental fitness test or an evaluation about his mental stability or emotional stability, would you vote to invoke the 25th Amendment?
There hasn't been a president who's more
Mr. Secretary, my question is, would you vote to invoke the 25th Amendment? Mr. Secretary, reclaiming my time. It's my question, Mr. Secretary. Would you invoke the 24th Amendment if he were to fail an assessment of his mental stability or emotional stability?
As I said, President Trump is the most...
Apparently not, Mr. Secretary. Apparently not. Mr. Secretary, we can all see that this president is mentally unstable, emotionally unstable, and is unfit to lead this country. You, as the nation's top health official, have a particular role here, and you are choosing your loyalty to Donald Trump over your loyalty to the Constitution and keeping the faith with the American people. Thank you, Mr. Chairman. I yield back.
Well, you need the fundraising video.
Mr. Chairman,
the gentleman's time has expired and been yielded, and I can ask the second grade classes to turn in again at this point. I'd hesitate to say something about the 25th Amendment with the last president. There was no concern there from the other side, but I won't say that. So now I recognize the gentleman from Georgia, Mr. Allen, for his 5 minutes.
But you just fucking did, you fucking pedo supporter. Oh, God. What is this?
You know, that's what we should be concerned about here today. But for years, pharmacy benefit managers have benefited from opaque pricing tactics while health care costs continue to soar. My legislation, the PBM Kickback Prohibition Act, would prohibit PBMs from paying consultants
Maybe he'll get a
and
pardon,
brokers
Dan.
who give trusted advice to employers and group health plan fiduciaries from taking
I'm not going to say the
compensation
thing I just said. I know.
steering
I'm thinking it,
businesses,
Pep.
to PBMs. What steps can HHS take to curb PBM's abusive practices, and how might Congress be able to assist in this effort?
Well, it's one of the, I would say, perverse features of the healthcare system that PBMs who add nothing are getting 40% of the profits from drugs, and they're driving up costs everywhere. President Trump has us laser focused on fixing the problem, and I want to thank Congress for passing the recent bill that allows us to now go and negotiate with the PBMs. We were already doing that. I want to commend Cigna and David Cordani for actually developing a model that is much more rational and that gets rid of the hidden kickbacks, that delinks the cost of the list price of medicines from the compensations of the PBMs. The PBM's compensation was increased by getting you to buy the most expensive. There's supposed to be a neutral arbiter on your side. They made money if you bought the most expensive form of that medication.
What is it, bitch? Is it neutral or on the side of the patient? So I'm just looking at what the key PBM changes, because I didn't realize this. In February 2026, because again, this was probably in the Federal Register and I just missed it. President Dump signed the Consolidated Appropriations Act 2026, enacting major pharmacy benefit manager PBM reforms to lower drug costs by cutting out middlemen, requiring PBMs to pass 100% of rebates to employer plans, and capping compensation via flat fees rather than drug price percentages. Well, I can't wait to see. Oh, here we go. Kaiser Family Foundation. Separately, but that's just an executive order. I'm going to have to read about that. Because this is, you know, like CVS Specialty Health and stuff like that. I'm not sure what the downside is of this PBM change, because there has to be a downside. I'm sorry. They are not going to literally just cut one middleman out. So there is a catch here somewhere. It's not fair to describe a notice in the FR as a thing you missed. It is unreasonable to expect one person to keep up, maybe with one's agency activity. Yeah, that's true. But still, it just makes me mad, because it's just like the freight train is rolling, and not that, standing in front of a freight train is going to do anything, because it tends not to. I guess it's just the quixotic nature of my personality, thinking that by knowing I will be able to be happier. Oh my God. Okay. Well, we'll take a look at PBMs later.
So they were steering Americans always toward the most expensive one, and that's one of the things that drove up health care.
Well, we're losing pharmacies every day in rural America.
And we're getting
this stuff's got to stop.
That is destroying our health care system.
And then let's talk about health care affordability. Affordability is a big subject today, and obviously we spend twice what any other nation spends on health care with worse outcomes.
Oh, I can see how important it is. Yeah, super important.
I'm talking about American workers and their families in ERISA specific.
No, there isn't a rebate to consumers. Thank you, Grace Lisa. Great question. What I read on the changes, which I am going to do a little more research on before I speak widely about it, is that there's a rebate that goes back to the plan provider, the insurance company. The insurance company gets the rebate. So no, we don't. It's too bad, because it feels like it would be a really good, obviously tedious, but very good way to organize part of your work. I don't know.
Which is where we cover most of the lives. What do you believe is the underlying causes of high health care costs, and would you please discuss how much control employers who provide health benefits for their workers have over these costs?
Well, the biggest driver of health care costs is the chronic disease epidemic. So when my uncle was president, we spent zero on chronic disease in this country, zero.
He's not going to say anything else that's worthwhile in this one. Let's see if anybody else does a good job of questioning. Oh, I like Ms. Adams. She's good.
Now I recognize the gentlelady from North Carolina, Ms. Adams.
Thank you, Mr. Chairman, and thank you, Secretary Kennedy, for being here. I have a yes or no question. Do you agree that there's a connection between nutrition and health?
Of course.
Thank you. So nutrition and the importance of healthy foods seem to be a core part of the MAHA movement. Is that correct?
Of course.
Okay. Like you, I believe that you can't be healthy if you're hungry. But as Secretary of Health and Human Services, do you, in your capacity, advise the President on nutrition issues as they relate to health?
You mean his personal health?
On health issues, any of it?
Oh, yeah.
Okay, thank you. Well, as I'm sure you know, many studies show...
Why is he being such a fucking smartass? Why has he got a tone in every motherfucking answer? She was asking about public health. What is wrong with this guy? Is it like syphilis or something? Does he have like some like sexually transmitted disease that has embedded itself in the... That's the job?
Is a critical time for proper nutrition. So a person's diet in childhood has a massive impact on their lifelong health and chronic disease risk. In February, you visited an elementary school where you had the opportunity to observe their scratch cooking practices and discuss the importance of serving healthy and fresh foods with school administrators and food service staff. So can you tell me why then did the President's budget include major cuts to programs for child nutrition, like the $5 million from the farm to school program, eliminating school lunch equipment grants, and reducing the benefits that mothers and young children receive for fresh fruits and vegetables under the WIC program.
We are absolutely committed to child health and good nutrition. We just put, we've preserved Head Start from any of the cuts, and we just put $62 million into Head Start to make sure that the 660,000 children who are in Head Start can have
All right,
good,
let me reclaim my time. I have some other questions. So, did the president discuss these proposed cuts with you?
Did the president? No.
Yes. Okay. Well, cuts to the program that help ensure access to healthy and local foods would be a betrayal, I believe, of the MAHA agenda, which is your agenda.
We are expanding.
So, excuse me, sir, I'm claiming my time here. Do you agree with these cuts being included in the president's budget?
We are expanding access.
Can you give me a yes or no? Do you agree with the cuts being proposed?
We are
in the budget?
expanding access.
All right, I'm reclaiming my time. Do you agree or do you not?
We are
Can you
expanding.
say yes or no? Okay. So, can I count on you to urge the president to reconsider these cuts and instead invest in school meals?
He is.
Can we count on you? Is that a yes or no? Can you give me a yes or no? Can I count on you to
providing good nutrition to children? Absolutely.
All right. So, well, listen, it seems like, and I'm glad you said that, but it seems like a betrayal of the people who have been promised by you as secretary to use your position to make food healthier. So thank you for clarifying that for the American people. Now, let me ask you about a survey of school food service directors who found that 79% of respondents expressed an extreme need for an increase in funding in order to expand scratch cooking and reduce the use of ultra-processed foods. So that same survey found that there's a serious need for additional staff, additional equipment, culinary training, and infrastructure. So, sir, are you aware of the barriers such as food cost inflation and lack of kitchen equipment that schools face in serving healthy meals to children across the country?
I'm absolutely aware of it.
Okay, so that's good to hear. But the budget,
and we are doing
the budget
about
fails. Excuse me, sir, I'm claiming my time here. That's good to hear. Because the budget fails to provide any investments. In fact, it does the opposite. So what should I tell? I'm reclaiming my time. So what should I tell food service directors in my district who want to make the transition to less ultra-processed and prepackaged foods, but can barely cover the costs of these expenses? What should I tell them?
You might start by telling them the truth.
All right. Well, I'm not getting that from you. But I suggest that you take the time to meet with food service directors across this country for a better understanding of the financial pressures on school meals programs. Many programs in our country are just not well funded enough. They're not, and you keep supporting the cuts in these budgets. They're not well funded enough to prepare meals and serve less ultra-processed and prepackaged food, all of which are alleged goals outlined in your MAGA report, Make America Healthy Again. You're not doing it, Mr. Secretary. Mr. Chairman, I yield back.
The gentlelady's time has expired. I
yield back.
I recognize the gentleman from Kentucky, Mr. Comer.
Thank you, Mr. Chairman, and Mr. Secretary, thank you so much for being
insurance.
That if you,
for parity. Okay.
Yeah. Spend it physically.
I now recognize the gentleman from New Jersey, Mr. Norcross.
Thank you, Chairman, and I'd like to thank the witness for being here today, and hopefully in the next...
Oh, my God. Grace Lisa, I love that little girl. Listen, or little boy. I don't know. It's a TikTok, right? Listen, Linda. That little kid is so cute. They are so cute. Oh, my God. Listen, Linda.
Conversation that is unfortunately near and dear to so many people in the United States, certainly your family and my family, and that is the mental health and the disease of addiction. And the budget that is proposed speaks of the values of that organization. So in particular, I want to talk about the mental health parity. We've seen devastation, the impact that addiction has on families. I encourage you to
or during your Senate
qualifications. So the had a million that disappeared. We cybersecurity is show us that.
Thank you, Mr. Chairman. First of all, Mr. Secretary, thank you so much. We watched for decades as Americans have gotten sicker and sicker, and our country and individuals going into this financial ditch. I'm thankful that we're finally righting this ship, so keep up the good work and innovation. Early this year, we saw how the Child Care and Development Block Grant funding was defrauded in Minnesota to enrich bad actors taking advantage of a broken system there. In fact, the HHS audit report finalized last year made several recommendations for Minnesota to improve their anti-fraud measures. To your knowledge, did Minnesota work to implement those recommendations before the news broke, widespread fraud there? Yeah.
Microphone, please.
Congressman, let me just say, take a moment to say how delighted I am to see you and say a word about the Oakland Raiders, which is your former team. During the 1968 campaign, my father's bodyguard for a lot of that campaign were 4 members of the fearsome foursome of the championship Oakland Raiders team, Rosie Greer, Merlin Olsen, Deacon Jones, and Lamar Lundy. And the night that my father was killed, Rosie Greer was the first person to grab Sirhan's. So my family has always had a very, very strong connection to your team, and I'm really grateful to see you here today. We went after both blue states and red states because there were fraud in both. Florida had some of the biggest fraud in the country. The Florida Attorney General and the governor cooperated with us, particularly in durable medical equipment, also in hospices and in child care and home care. Minnesota is the opposite. They just absolutely refuse to cooperate.
No, this is not true. All right? I'm sorry. This is not true. Minnesota had been investigating the fraud well before the Dump administration came along and decided to send little sycophant incel children out to bother people. And so, and I was also looking at the CMS, he just referred to this, management, what was it called? Program integrity, comprehensive Medicaid integrity plan. That started in 2024. So there's been a plan that put in by the Biden administration and whoever was running HHS, I can't even remember now. Not terrible. To actually to look at fraud. So anything they claim around this like integrity program, those are things that have already been in place. This administration, this regime did not, first of all, they are fraudulent. Oh my God. Can we talk about World Liberty Financial? Because it's going under. And this president is fraud. He was convicted of fraud. He is fraud. He is the face of fraud. 34 counts.
We asked them to provide receipts. They had already paid the providers.
I don't even think I can do this.
And we now had to reimburse.
It's obvious that gun violence are the
agencies and states. This creates real vulnerability
to rural communities where it's absolutely critical.
Gentleman's
forward
time
to
has
working
expired.
with you.
God damn it.
I now
Fuck
recognize
all of
the
you.
gentlelady from Georgia, Ms. McMath.
Thank you, Mr. Chairman, and thank you, Secretary Kennedy, for being before us today. You have characterized many things as epidemics and threats to public health, including autism and the presence of fluoride in our drinking water. Shootings are the number one cause of death for children in this country, and they have been since 2020. But when you were asked if gun violence was a public health crisis during your Senate confirmation hearing last year, you answered with a succinct no, which I would like to submit digitally for the record. My son Jordan Davis was murdered in a shooting at just 17 years of age. Simple answer, yes or no. Do you believe that gun violence is an epidemic or a public health crisis?
I would say it's an epidemic. I think it's a law enforcement issue and not public health.
I find it kind of absurd to hear you say that.
What? Gun violence is not related to public health? Are you kidding me? Are you joking?
Yeah?
What?
I really do.
You think I should be regulating gangs at
I
HHS?
think, Secretary, it's my time. I think it's kind of absurd to hear you say that. So can you tell me how many children were killed by fluoride toxicity in my home state of Georgia in 2024?
Fluoride toxicity? Probably none.
You're right. The answer is absolutely zero. So can you tell me how many children were
fluoride
killed by
doesn't kill you.
fluoride across the country in 2024?
Fluoride doesn't kill you. That's an absurd question.
Again, that answer is zero. So how about...
Nobody would answer that, ask that question.
I'm reclaiming my time. How about by firearms? Can you tell me how many kids were killed in shootings across the country in 2024? You can see right behind me.
I can't read it.
3,865, over 10 a day. That's more than drownings, more than car accidents, more than cancer, and certainly more than fluoride. It is far more than many of the things that you choose to focus on in your time as Secretary. I'm reclaiming my time, Secretary. It's obvious that gun violence is an epidemic, and it is both a public health crisis. I know it, and so do the thousands of parents who are burying their kids in this country every single year. But what I don't know is how you can expect the American people to take your opinion seriously when you try to tell them that they don't need to worry about the leading cause of death for their kids.
I never told them
I'm reclaiming my time. While you tour the country to talk about the supposed dangers of fluoride, you should focus your efforts on things that are really killing our children in this country every single day. We have limited time here, but I also want to ask you about your comments about people with disabilities, especially about people with autism. During your first press conference as Secretary in April of last year, you said, and I'm quoting, "Autism destroys families, that these are kids who will never pay taxes, never hold a job, never play baseball, never write a poem, or go out on a date. Many of them will never use a toilet unassisted," which I would also like to submit for the record. The truth is that the majority, I'm reclaiming
Without
my
objection,
time.
it will be
Thank you.
submitted.
Thank you. The truth is that the majority of people on the autism spectrum can do all the things.
Kimberly Guilfoyle will take care of that, Jim. Don't worry. That's why Kim is in Greece as the ambassadress. She doesn't like the word ambassador. She wants to be the ambassadress. So.
That you
Of course
have
they can,
mentioned.
and I never said they couldn't.
Some people with disabilities do need direct care to assist them with activities like going to the bathroom, but that does not mean that they are somehow less than or unable to lead fulfilling and productive lives, as you
And
have
nobody said they
implied.
were.
I'm reclaiming my time. I'm asking you here today, Secretary, to apologize for spreading lies about people with autism and their families. Will you apologize for those remarks that you've made?
Of course not. Then if you let me explain, I'm happy to. I was talking about people with profound autism, not people who are, who have lower impact autism. I'm talking about people who are nonverbal, non-toilet trained, headbang.
He's doubling down. He's doubling down. He does believe this. What the fuck?
Stimming, toe walking.
Okay, then since you
hundreds and hundreds of people have written me letters thanking
what
me
you really
for
meant,
those comments.
since you're explaining what you really meant, can you apologize to the thousands of families that do not believe what you're just telling us now?
No, because if you look at my comments, it was clear
apologize.
who I was
find that
talking
very,
about.
very sad. I find that very, very sad. It should be very easy for you to apologize if that's not, in fact, what
Those
you
are
meant.
crocodile tears, Congresswoman.
And for all the families that have children with autism, I'm very sad to hear you say that, because those families are dealing with the kinds of conditions that many people just don't even understand. The president is trying to close the Department of Education. If that happens,
keep talking.
I'm reclaiming my time. The president is trying to close the Department of Education. If that happens, services provided under the Individuals with Disabilities Education Act, including special ed, may move under your jurisdiction. This is unacceptable for so many reasons, but one of the most important reasons is this: no parent wants their son or daughter's education to be in the hands of a man who openly admits that he does not believe in their children. And I yield.
The gentlelady's time has expired. I now recognize the gentlelady from Illinois, Ms. Miller.
Thank you, Mr. Chairman. Mr. Secretary, would you like to respond further?
I was very clear in my...
Putting women at increased risk. In fact, at least 10% of women who take the pill
vaccinated or whose vaccinations
choose life and not abortion. And
expired. I now recognize the gentlelady from Michigan.
Fuck off, cunt.
Well, thank you, Mr. Chair, for holding this hearing, and Mr. Secretary. It is, in fact, true. I come from the great state of Michigan, and as you enter your second year as our nation's Health and Human Services Secretary, I just had a few things I wanted to tick through with you here today. So in early 2025, after your confirmation, measles cases spiked in the United States to the highest levels since 1991. Last year, we had over 2,200 cases in America. 3 people died. 2 were children. Do I have that correct? Because according to the CDC and the American Academy of Pediatrics, I do. During this same time,
that epidemic started before I came
during
into
this
office.
same time, you questioned the effectiveness of the measles vaccine. And then in September, your hand-picked vaccine panel voted against recommending the combined measles vaccine for children under 4. This is true?
It was dangerous.
We know now that over
version.
90% of measles cases in 2025 were among people who were unvaccinated or whose vaccination status was unknown. That's correct? According to the CDC,
we should have given a dangerous vaccine that all the science
in just the first 3.5 months of 2026, the year we're in right now, we've already seen an additional 1,700 measles cases. I assume you're aware of this, according to the CDC.
There's a global epidemic.
You have also pushed vitamin A as a treatment for measles. That is correct?
Yeah, every
according
major
to
health
the America's
organization in the world
Poison
recommends
Centers,
it.
vitamin A overexposure among children increased by nearly 40%, and in this time frame, children in the hospitals with both measles and unsafe levels of vitamin A has occurred, correct?
I'm not recommending unsafe levels. I'm recommending what every
The
major international health
Poison
organization
Centers,
recommends.
The American Poison Centers agrees. You characterized your response to one outbreak in Texas as a model for the rest of the world, even as the number of measles cases climbed. As Secretary of Health and Human Services, have you ever taken steps to undermine medical guidelines rooted in science? Because we can look at your record, sir.
Oh,
I serve on the Science Committee. At the beginning of this year, the CDC tried to slash the childhood vaccine schedule from 17 recommended vaccines to 11 before it was blocked by a judge. Hepatitis A, B, RSV, multiple vaccines were demoted. Do you dispute this charge, sir?
You think that we should recommend interventions
These
that
vaccines
have not been safety
have saved
tested?
countless lives.
They have,
A
you
2024 study estimates that childhood vaccines have saved 1.1 million children's lives and prevented more than 500 million illnesses in the last 3 decades. Doctors, researchers, and medical experts have spent years working to not only understand illnesses, but also prevent them. Your actions restricting these vaccines have a grave impact on our country. And while you have waged war against established medical science, you've also attacked life-saving research on cancer and Alzheimer's. You have implemented measures that have raised costs, kicked families off their insurance, and made it harder to get coverage.
You're just
devastated
making stuff
rural
up.
hospitals. Look, to top it off, Mr. Secretary, I got a copy of H.R. 944. Do you know what it is? It's your impeachment articles, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office. I yield back.
The gentlelady's time has expired.
No, it's not a question,
Now
cunt.
recognize the
Sit
gentleman
down.
from Missouri, the good Dr. Under.
Thank you, Mr. Secretary. Thank you for being here. I'm glad my colleague got her little X is most calling them doctors.
The report says pass through the Congress.
Just as we saw the AMA and the plastic surgeons change
I
their
think your
position on
balls
mutilating
taste really good in
procedures,
my mouth right
after
now.
the
Yeah,
big
I
verdict
think
in New York.
if you could just lower.
Do you think it's time that we be able to?
Do you think it's time that you and I
hold
call
those
this official and that we're
harm our
really?
children in
I
this
love
way
you.
strictly
I love
accountable?
you,
It makes a lot of
Mister.
sense to me.
I love you,
There's
Mr.
no-
Kennedy.
the science is
I
so
love you,
clear
Mr.
that this is
Kennedy.
a
I love
harmful
you.
procedure with
Well, I
very
love
few
you too.
little evidence
Okay,
of
I
any
love you
benefits.
too.
We'll work with you on that. No, I appreciate that.
I appreciate
And,
I
you know,
love
the
you.
one
Can I just tell
talking
you,
point
I
that
love
these
you. I look like Bill
transgender
Maher,
doctors,
and I
have a
love
hard time
you.
even calling them
I love
doctors,
you.
but
I
these
love
facts
you.
say is this is going to
I
improve
love
kids'
you.
mental
I
health,
love you. I
prevent
love you. I love
suicide.
you. I love
There's no
you.
evidence of that. There's no evidence of that in the
I love you.
Yes.
Whoops. God, I want to
Yes.
hit Kesar's beginning.
And you've also met children in this way strictly.
Fuck,
Double
man.
in
Andre,
boys,
you won't shut
they
up.
go up sixfold.
Shut
so
up.
I think there's never been a good evidence, and now there's abundant evidence that we're doing more mental health harm than good.
I thank the gentleman.
Thank you, Mr. Chairman.
Doctor. His time has expired. I now recognize the gentleman from Texas, Mr. Kassar.
Good morning. Secretary Kennedy, I have a few questions about who you're meeting with and talking to as you make this nation's health care policy and health policy. According to reports, you and President Donald Trump met with the CEOs of Pfizer, Eli Lilly, Pharma, and others at Mar-a-Lago. Is that correct?
Yes.
And you've also met with the CEOs of Pepsi and Tyson and Kellogg's. Is that correct, Mr. Secretary?
We met with people on both sides of the issue.
Yes.
Of course.
The CEO
We're going to meet with industry. It's part
Yeah,
of
and
my
the CEO
job.
of Starbucks as well. Is that correct?
Yeah.
Thank you. Do you know how many billionaires you've met with in your time in office? so far?
I would have no idea.
Well, at least at a cabinet meeting, there's, of course, Donald Trump, Mr. Lutnick, Ms. McMahon, Mr. Musk, so at least 4 or 5. So we've established here you've met with a good number of CEOs, some billionaires. I hear you've even met with Kid Rock. So here's my question. The Trump policy that passed through the Congress was to give some of these ultra-wealthy people a tax cut. And part
Which
of paying
policy?
for it, the big ugly bill gives the ultra-wealthy a massive tax cut. It's well documented. But part of what pays for it is kicking 15 million Americans off of their affordable health care. And you're Secretary of Health. So here's my question. You've met with the CEOs, you've met with some billionaires. How many people have you met with? How many Americans have you met with that have lost or about to lose their health insurance?
Well, I've met with the advocacy community on virtually everything that we regulate. I've met with more tribes and tribal leaders than any HHS secretary in history.
And I'm grateful for your meeting with tribes and advocacy organizations, but have you met with everyday Americans who have lost their health insurance just this last year?
I meet with everyday Americans every day.
And have you had conversations with those Americans who will lose their health insurance this coming year or next year because of the cuts to Medicaid? Have you met with people who have lost their health insurance?
First of all, there are no cuts in Medicaid. There are no cuts in Medicaid. Look at the CBO report from this week. We are increasing Medicaid spending by 47%
So we've got
over the next 10 years.
So over $1 trillion comes out over the next 10 years. report after report says
Increasing
15
spending
million,
by 47%.
15 million people could lose their health insurance.
How is that a cut?
Okay, let's talk about
That is
then
only a cut in Washington, D.C.
Have you met with any of the 1.4 million people who have lost their health insurance just this last year from dropping off of Obamacare? Have you sat down and talked to those folks about the fact they won't have their health insurance again?
They're almost all illegal immigrants.
Oh, well, you know what? It sounds like you haven't met with folks like Portia in my district.
We found 1.5 million illegal immigrants illegally collecting Medicaid.
Oh, great. Show us the data. Show us the data. Show us the data. You have a number. You should be able to back it up. What's your fucking data? Oh, and by the way, just on a basic level, I actually don't want anyone in my community to be sick because at the most selfish level, they might make me sick. So how about we make sure that everyone, including people who don't have the right paperwork for you, if that's your issue, if you can't get over that, I want them to be healthy too. Guess what? So I would actually go to the other side and say, I want people who are here with or without documentation to have health care. Because frankly, if I have a healthier community, everything goes better. That's it. That's like how the world really works. Yeah, RFK will rot in hell easily. Good morning. I will tell you right now. He not only can he will. In fact, he already is rotting from the inside out. And it's just about ready to burst.
There are people like Portia in Buda, Texas, whose health insurance costs went from $100 a month to $500 a month. People like my constituent Shauna in San Marcos, Texas, her premium went from $250 to $750 a month. Now, $500 a month may not be a lot to you or to some of the billionaires that y'all are talking to, but for these moms with kids, they've lost their health insurance this last year. So have you had a conversation with, how many people have you sat down with that have said, Mr. Secretary, I lost my health insurance this last year. What are we going to do about it?
87% of the people who are on Obamacare are paying less than $96 a month. 54% of the people who are on Obamacare today are paying less than $50 a month.
Well and good for us to talk about Obamacare policy.
And by the way,
question is, it sounds like the answer.
Democrats had 3 chances to make.
We could talk all we want about the past.
Tax credits.
We could talk about.
Why didn't you do it?
We could talk about the past.
Why didn't you do it?
Because it wasn't. It
Mr.
was
Secretary,
a
just like you,
broken
I'm
Congress.
new here. I'm responsible for what's happening right here and now.
Your colleagues.
My question, Mr. Secretary, is: have you met with anybody that's lost their health insurance?
Oh my God, they do have a class of second graders? Oh my God, Pep. Oh, Jesus. Whose idea was that?
And it sounds like the answer is 0. So my question was, you've had time to meet with the billionaires. I know it's a lot of fun to meet with Kid Rock.
True, I have met with people
who have lost their health insurance because of the policy from this last year.
Yeah, people have come up to me and said that they've lost their health insurance, and I talked to them.
And what have you said to them? How can you explain to them how, as you're trying to make America healthy, that they now can't see a doctor anymore because of the policy?
Point them to other options. And President Trump is trying.
When somebody's health insurance cost goes up $500 a month because of Donald Trump's policy, I don't see how you could honestly tell them how you're going to make this better for them.
It is the Democratic policy to benefit billionaires. The insurance companies, stocks raised by 1,000.
Nothing the Democrats, first of all, there's this beautiful disinformation point that they love to have, saying that Democrats are the heroes of the insurance companies. That's simply not true. Because the insurance companies, guess what? Even with their new plan to, send you the money to do your premiums, all that means is that you then get to pay higher prices with that money to the insurance companies. The insurance companies are not going away. Trump loves the insurance companies. They love him because he's making sure that they get the chance to charge us more, right? Because breaking it out of the group model and into the individual marketplace, right? So their prices go up because they don't have a predictive model. I mean, people, there is actual fucking data about why what this regime is proposing for the way they make healthcare cheaper is not working. They're not going at the core profit centers like the insurance companies, like the PBMs, like the large medical groups. They should be looking at where the profit centers are fucking up and where they're taking advantage of the system and where the providers might be taking advantage of the system. But you don't go after the people actually trying to access healthcare, because whether or not a human is good or bad in your estimation doesn't matter, because they still get sick. Okay? So even bad people that you may not like get sick and need healthcare. It's not a moral issue. And the fact that you wouldn't even ask that this regime demand more of the insurance companies, notice they've not been to the fucking White House. If you would ask the guy you voted for, if he would actually work with the profiteers off of healthcare and get them to, frankly, lower their profits, because healthcare shouldn't contain a profit. Oh my God. I can't even take this country anymore. I just can't even take how stupid this is. How stupid it is that we're here. God, I would so much rather be fighting a Democratic, a Democrat. I would so much rather be fighting the Democrats right now for being better Democrats than fighting all of these motherfucking fronts for just the most basic of humanity. Jesus fucking Christ.
7% after Obamacare was passed. The money was not going to Americans. It was going to them, and it was you who did it.
The gentleman's time has expired. We need to move on.
Chairman, it just sounds like he's met with nobody and been able to explain to them why it's okay that this policy kicks them off their health care.
I now recognize the gentleman from North Carolina, Mr. Harris.
Thank you, Mr. Chairman. And Secretary Kennedy, thank you so much for being...
Details.
I understand, completely understand.
Pension of Medicaid, Medicare.
Thank you, Mr. Chairman. So this is Black Maternal Health Week, so I'll just start there. Secretary Kennedy, I'm sure you're aware that Black women are at least 3 times more likely to die from pregnancy-related causes than white women. The vast majority of those deaths are preventable. Black women in my district are more likely to die during pregnancy than their peers in 97% of U.S. cities.
Okay, I'm just going to say it now. Summer Lee 2028. This is who I want. I want Summer Lee to be the president.
Your written testimony mentions maternal and child health 4 times, but from what I've seen, the NIH canceled grants researching Black maternal health. Your administration's fiscal year 27 budget proposes eliminating Healthy Start, which is one of the federal government's primary community-based maternal health programs. And you've made it a priority of HHS to end diversity, equity, and inclusion. So yes or no, my question for you is, if a medical school or a public health school educates students about addressing the Black maternal mortality crisis, would you consider that an illegal DEI?
No.
No, you would not?
No.
Great. I do hope for the medical schools, the universities, and the accreditors, your administration has been threatening that they're watching this and take this directive to continue teaching about and addressing the Black maternal mortality crisis. And I expect your agency to restore and expand funding and support for that work. Also, yes or no, do you think consuming more protein and avoiding Tylenol will prevent Black women from dying 3 times more likely during a pregnancy?
I doubt it. Tylenol doesn't kill you.
So then why aren't you putting forth serious policies that actually address the health crises in this country instead of just these unserious conspiracy theories and this wellness influencer mess that we...
Do you want me to answer that question, or are you just talking?
No, it's a question.
We are doing more on maternal health than any other administration.
No, I said black maternal health.
On maternal health.
Black maternal health.
That includes blacks and whites.
But the thing is that they're actually not the same outcome.
Exactly. Black maternal health is actually very specific and very, very complex and has a host of factors. And that's what she's trying to ask about, is whether or not he pays attention to the fact that maternal health is not all maternal health, that black maternal health actually has characteristics that deserve to be uplifted because there are some causal components that we could actually address if we cared.
Which means that we need specific and intentional interventions for black maternal health and black infant.
Can I finish? I'm saying.
Are you going to answer that?
Yeah, we have right now, we've implemented a perinatal pilot project that we're in 220 hospitals around the country, and we have reduced maternal health mortalities by 42% at those hospitals by providing them protocols.
Can you please share what the reduction has been for black maternal health?
Across the board, it's 42%.
But black maternal health still has worse outcomes than other people.
I wouldn't know. It helps everybody.
But it isn't.
You object to that?
Okay, thank you. It is not. I do want to just, for the record, state that. It does not help everyone. Your agency told programs to remove a list of nearly 200 words and phrases from their funding applications, including the word black. Do you have an idea of how we could solve the black maternal mortality crisis if we can't say black?
President Trump is trying to end division in this country, not so division.
Not eviction.
Done during the last 4 years. That's what DEI did. It divided people. It polarized people.
No. We're not talking about eviction. We're talking about health care.
I'm calling about DEI.
We're talking about health care.
Yeah.
Disparities. So what we're asking is if you attack DE&I and then we have a crisis that impacts one population over another, but you cannot direct specific spending or research or interventions to that population, how do you solve the problem?
Do you think the federal government should be paying for DEI?
I think the federal government has a vested interest in ensuring that its citizens survive childbirth.
Well, we are meeting that obligation.
We are not.
Oh, that I can explain to you how we are.
You have not done so far. But also I would say that, we can improve health care for everybody at the same time as helping the people who are most likely to die. That's what DE&I, well, first of all, DE&I makes sure that we have black doctors or women doctors. We're talking about the fact that we have a mortality rate that is not matched by any other country as what we would call developed as ours. Really quickly, in yesterday's Ways and Means Committee hearing, you denied saying that every black kid is now just a standard put on Adderall, SSRIs, benzos, which are known to induce violence, and those kids are going to have a chance to go somewhere else and get reparented. Why did you deny saying this?
Why did I deny payment?
No, why did you deny that you said that every black kid is now just standard put on Adderall, SSRIs, benzos, which are known as to induce violence, and that you would rehome them?
Well, it's largely true that black kids, because it's easier to handle people, and a lot of the public
And you're going to rehome them?
No, I never said that we should rehome them for illegal drugs. Psychiatric.
Gentlelady's time has expired.
Okay, I just wanted to know if that was him, for the record. Thank you.
Thank the gentlelady.
I yield back.
I recognize the gentleman from California, Mr. Kiley.
Thank you, Mr. Chair. Morning, Mr. Secretary. I just wanted to first start by...
Is a protein, and that's what they did. They gave it, but we...
This, I think it'll benefit our...
And a president whose term ended in assassination and is widely regarded as someone who navigated our country through possibly the most challenging time of the Cuban Missile Crisis. There were two pictures that hung in the homes of Irish Catholics in my neighborhood, separate pictures. One of your uncle, President John Fitzgerald Kennedy, and the other of the baby Jesus, the light of the world, two separate pictures. So I thank you for being here today. I have various concerns about the direction of HHS under your leadership, but today I'd like to focus on some particularly harmful attacks made on the disability community. Your actions and statements, Mr. Secretary, have contributed to real fears, anxieties, and consequences for millions of families. I know some of my colleagues have raised these with you as well, but I want to again point out some of the statements that I think reveal a bias and a credibility issue. You previously said that people with autism, and again, I acknowledge your statements previously in this hearing, that these are the most profoundly autistic individuals, but the impact it has on families and statements that they will never hold a job, never play baseball, never write a poem, never go out on a date, or never use a toilet unassisted, those are incredibly impactful. Additional statements that individuals with autism and the epidemic that exists is catastrophic to our country and destroys families. As these words weren't insulting enough, you've also insinuated and insulted the intelligence of American people by linking autism to vaccines, Tylenol, and circumcision. Mr. Kennedy, not long ago, any of these claims would have been disqualifying for someone in your position, especially given a lack of scientific or medical training on your part. These would have prompted dismissal, and we would have dismissed these statements as ridiculous and unverified theories. But in this administration, falsehoods are routinely given a platform and are perpetuated. Incompetence is also often rewarded, as is loyalty, and there's very rarely accountability for statements such as this. Mr. Secretary, as a science teacher at a college level for almost 30 years and the former chairman of the Disabilities Committee in the New York State Senate, I have worked intensively with individuals with disabilities and their families, understanding their concerns, so that experience goes back a long time. And as a country, we have made massive strides in improving disability policy. But now, under your watch, we're moving in the wrong direction. A $1 trillion cut to Medicaid that you have let happen and have tried to downplay is dismantling many important programs, including the Administration for Community Living at HHS, which oversees programs supporting senior and individuals with disabilities. And now, you and Secretary McMahon seem to be working behind closed doors to dismantle the Department of Education and expand HHS's role in key educational programs. Unlike you, career public servants at the Department of Education have worked for decades to develop expertise, expand educational opportunity, and protect the rights of students with disabilities. I cannot believe that we are talking about shifting critical programs that are enshrined into law and into the Department of Education over to HHS. In lieu of going over on my comments, I will end my time here. Thank you, Mr. Chair.
Gentleman's time has expired. Yields back.
100% GP. Hello.
Gentleman from Pennsylvania and the
Hello, my
champion
friend.
of whole milk, Mr. Thompson.
Thank you, Chairman. Mr. Secretary, good to see you again.
You too.
Always appreciate your meals are served.
That good food is military, and we were paying.
Secretary.
While we'd like to talk more about crispy.
Oh, whoa, the fuck, whoa. Did he just put a pouch in his mouth? No, literally, everybody. Did he just put a little tobacco pouch in his fucking mouth?
Preparing, I anticipate, hopefully in the next couple of weeks, to see published in a congressional record just clarity that this will apply not just to school lunches, but for breakfast and, quite frankly, any time that meals are served.
It's called a
within the
snack,
school
sir.
system. Any thoughts on what steps that can we take to help schools successfully transition to offering whole
I
milk?
want to get to the... Are you a dairy farmer?
In many cases, cheaper, and the processed and ultra-processed foods that they were getting.
Just watch his
much
hand
cheaper
in his...
than fast food. In fact, our program in the military,
his left cheek.
Pete Access is shifting the military on the terrible, appalling food that they had that only a third of the troops were eating. And we were paying $18.
Did you get them? Oh, is that what the crab was for?
On 5 bases, about to go into 20 bases, with good, rich, whole food, a lot of it locally
This is hilarious. This is hilarious after the post on that was going around that was viral. I don't even know if that was real or not, but it was like soldiers sending pictures of their meals, and it's all like, you know, like disgusting gray meat and terrible looking food.
And we're
But
feeding
wait,
about
I know.
$10
It's Zin. What's a
So
Zin?
it's, good food is not more expensive as long as you're cooking
Here we go.
at
Here we
home.
go.
Well, thank-
Okay, watch,
thank-
watch,
time
watch,
has
watch,
expired.
watch.
While we'd like to talk more about Krispy Kreme and chocolate whole milk, we're going to move now
did it!
to the gentlelady from Connecticut, Mrs. Hayes.
And then dogs on shitty food.
Thank
yeah,
you.
exactly.
Good afternoon. Firearms are the leading cause of death for children and teenagers in the United States. Pediatricians, trauma surgeons, emergency physicians, and public health experts have repeatedly described firearm injury as a public health emergency. As my colleague stated, when you were asked during your confirmation hearing,
He's going to die of mouth cancer. That's like mouth cancer shit. Right? Like, that's what that is. I mean, I smoke a lot of weed, so I can't say anything. But for someone who claims that his body is a temple of doom. Yeah, his body's a temple of doom. Yeah, it's kind of odd to see him do that. I mean, I don't begrudge anybody. Yeah, better for the old than the young. Yeah, that's for sure. I say double up, sir. That's what I say. Also, maybe education department gets involved to disprove chocolate milk comes from brown cows. Grace Lisa. Wait, what? No. I think Senescent should take up smoking. Yes, I think so.
if you believe firearm violence was a public health crisis, you answered with one word, no. You went on to say, you believe that HHS can explore solutions for the behavioral health and substance abuse epidemic without compromising sacred rights and freedom. According to EdWeek, which measures school shootings at K-12 schools resulting in injury or death, there have been 26 school shootings since you were sworn in. According to the Gun Violence Archive, which measures any gun discharge on school grounds, there have been 240 incidents since you were sworn in. In 2026, we have seen school shootings in Rockland, Maryland, Detroit, Michigan, Crandall, Texas, Bulverde, Texas, Ferguson, Missouri, Oklahoma, Bethesda, Maryland. As you stated, I understand that you don't have full jurisdiction over the law enforcement
Okay, well,
side,
that's
the
good.
DOJ, the
That's
FBI.
good. I did not know that.
And since this committee has refused to
your-
respond to my
your
request
nicotine
for a
pouches
hearing on school
do not
shootings,
necessarily
I want
cause
to ask you
cancer.
about the things
Consult
you
your
do
doctor.
have direct jurisdiction over. HHS holds jurisdiction over public health aspects focusing on mental health services, trauma support for survivors, data collection to prevent gun violence. Since under your tenure, we've seen threats of cuts to SAMHSA, cuts to school-based mental health programs, cuts to the CDC staffers who work on research and prevention, cuts to bipartisan community violence prevention programs. They've been terminated. So, Mr. Secretary, since you were sworn in and now have full visibility of the harm of gun violence to children, has your position changed? Do you believe gun violence is a public health crisis?
I believe it's a public health crisis, but it's not. We don't have jurisdiction to.
The things you do
enforce
have
it.
jurisdiction over.
And we're doing those. So we're doing more studies on the etiology and cause of gun violence, the first that have ever been done in years.
Sir, I have to
we're doing
stop
those,
you.
and
I only have
right
5
now.
minutes, and I apologize.
You asked
but
the question, so I answered it.
Well, I want to know specifically why the research and the funding
That's
has
probably
been cut
it.
for these
Those are
programs
his
that
spittoons.
address trauma, that address student survivors, that address school-based mental health programs for students who are affected by gun violence. You're
As I
putting out
said-
all of these programs, all of these studies about keeping kids healthy. Keeping kids alive is part of keeping them healthy.
And we're trying to do that by doing the studies to understand why people commit mass shootings.
But you've also cut funding.
That has not been done before.
You've also
It's been
cut
done by the
funding.
Trump
You've also,
administration.
sir, I'm going to have to ask you to exercise some restraint. You're a Kennedy. You know how oversight hearings work.
Well, don't
And we
pretend
don't
you're
want the
asking
second graders to think that your interruptions are rude, disrespectful, or impatient. So I'm going to have to ask you to just allow me to finish my questions.
Well, don't pretend you're
In
asking
my
a
home
question
state
if
of
you're not gonna give
Connecticut,
me
where I
chance
was a
to
school
answer it.
teacher, in the classroom on the day 20 children were slaughtered and 6 educators, we worked really hard to see firsthand how to invest in our communities and provide prevention. Connecticut has created some of the strongest school-based violence prevention systems in the country through multidisciplinary threat assessment teams, early intervention programs, and partnerships that help schools identify concerning behavior. I put forth a bill, the School Violence Prevention Act, to begin to collect data to see how we can have federal programs to address these traumatic outcomes for kids. Many of the things that we fought for in the Bipartisan Safer Communities Act have been cut. So I have to ask you, what have you done to address the health of children? You point out so many other things about the food they eat, all these other things. What have you done to keep kids safe from gun violence outside of commissioning a study?
As I said, we have no law enforcement. Congress has not given us law enforcement.
I'm not asking you about law enforcement, sir.
What we do is we study issues and we study problems, and we're doing that with gun violence, which has not been done before.
Specifically, a study that you've commissioned.
We did it. We've done. I think it's almost near completion. We did a study on school shootings to look at what the shooters have in common, what medications they may have been receiving, whether they were on SSRIs, whether they were on benzos, and we're expanding that now across the agency to do even more of those.
The gentlelady's time has expired.
I'd like more information on that study because I'm unaware of it. I yield back.
Happy to provide it.
Gentlelady yields back. I now recognize the gentlelady from Arizona, Ms. Grijalva.
I don't see it yet.
Thank you for your time today. I have to say, as I listen here, with all the health initiatives that you're espousing, I have grave concerns about the HHS bill budget and the cuts that are being proposed. I spent 20 years on a school board and saw firsthand how support systems children have or don't have outside of the classroom shape their outcomes. At the most basic level, children can't go to school if they're sick, they can't learn on an empty stomach, and their families can't get ahead if they can't access health care. I'd like to first talk to you about your proposed cuts to medical research. I was reading an article this morning that talked about your affinity to perform your own medical research. You apparently once cut the penis off a road-killed raccoon to study them later. You speak fondly of medical research, yet your budget cuts show that the National Institutes of Health are going to get a cut of more than 12%. This level of cuts would halt promising research, force layoffs of scientists and research staff, and undermine America's global leadership in medical intervention and innovation. What specific diseases do you believe deserve less medical research?
DEI.
Okay, so
we got $1 billion.
Do you have a specific program, a specific disease that deserves less funding?
I would say we're putting $1 billion into DEI, and DEI research has never cured any disease. It's never produced any new drugs.
Okay, so between February of 2025 and April of 2025, HHS canceled or froze more than $180 million in National Cancer Institute grants. Were you the one to approve these cuts to cancer grants, or did that come directly from the White House?
We're giving the highest, one of the highest budget increases to NCI.
Can you just answer my specific question? Were you the one who approved those cuts, or did that come from the White House?
As I said, we are raising the budget for NCI, for the National Cancer Institute, in this budget. It's one of the only agencies throughout my, sub-agencies throughout my entire agency that's receiving a raise.
Okay, so Secretary Kennedy, you have the responsibility to tell the truth to this committee, and here are some examples of cuts. In April of 2025, HHS canceled an NIH grant regarding strategies to reduce cancer and chronic disease in the Arkansas Delta. In 2025, a grant selective targeting of pancreatic cancer was cut. In March of 2025, a grant, the automated digital imaging for cervical cancer screening. The list continues to go on. You've also noted that SNAP can be used to purchase whole foods. And when we look at some of the recent data, just in Arizona, the district that I represent, 424 fewer people, including 180 children, have lost food assistance since the enactment of H.R. 1. My constituents are writing to me telling me that they're hungry and cannot afford food. As the Secretary of Health and Human Services, will you make a statement here today that you oppose hunger in this country?
Well, I oppose hunger in this country, and we're the first administration to be doing something about getting actually good food.
Thank you. I'm
children.
grateful that you're standing against the Republican hunger cuts. And if HHS spends $21 billion on physician training, yet only 1% goes to community-based programs like teaching health centers that actually reduce primary care shortages, why are we underinvesting in the models that work?
For rural health?
For community health centers.
I just put $143 million into community health centers for physician retention. We also put $50 billion into the Rural Transformation Process program, which has a lot of money for rural health care, frontline physicians, to retain them, to keep them, to do residencies there. It's unprecedented.
So just so you know, only 1% of the funding that you've talked about actually goes to teaching health centers and community health centers, and health centers lower costs and improve outcomes
You asked
for
about
Medicare
the problem.
patients.
We're trying to solve the problem of rural residencies and rural access to rural personnel. And we're
She's
doing more
talking
than
about
any
community
administration
health
history.
centers. He's so dumb.
Unfortunately, there are 5 rural health centers in Arizona that are at risk of closure because of cuts from this administration.
So go fuck yourself.
So what are you doing to ensure that every Medicaid patient can access a community health center?
There's 39 million Americans in community health centers, and my personal belief is that it's the most effective health centers in our country.
Absolutely.
What they're doing is better than any, and we're making big investments to make sure that they continue. We've raised the funding in this budget for community health centers, and then I'm finding other pockets of money funnel, as I did last week, $135 million.
I would really like to see the data that shows that, because the rural health communities and health centers in my district are suffering greatly under this administration.
Well, I announced the program.
And I yield back.
I announced the program in Arizona last week at a community health center.
The gentlelady's time has expired, and I would recommend making direct contact between the two of you. So thank you. I now recognize the gentleman from California, Mr. Desaulniers.
Thank you, Mr. Chairman. Mr. Secretary, I want to start with something I think we agree on.
There is no way I want to keep watching any of this. Oh my God. I think we get the point. I'm really appreciative of the mostly Congresswomen who stood up to this moron and really tried to tell him what's what. So I'm glad for that. I think I'm actually going to end a little early today because we do have our show tonight. Oh, and Grandma's got to get a nap in. No, I'm just kidding. But I will be back live tonight for trivia. That's right. It's Friday again. You never know what's going to happen on trivia. Oh my God. Thank you for agreeing to watch it. I mean, just by staying, I know people are making a sacrifice. This is so frustrating, everybody. I understand. You know what I have chosen to take away from that experience is not the pain that we just suffered, but that I learned about a couple of things that I really need to understand better about. Like, I pulled up the narrative on the HHS budget changes because I'm kind of interested if there's anything that jumps out in that. And now I'm looking at a Kaiser Family Foundation study on school violence, except for I don't think it's the study he's talking about. I can't see what the study is, so I'm curious about that. So I'm grateful for these sessions because it also opens my eyes to things that I may not realize are happening in the world. I mean, you already saw. I mean, I'm constantly missing the information that I would feel better if I knew, and I could like make those phone calls and do all that good stuff in the right way. So we'll just continue to try and do better when it comes to advocating. Advocating for humanity, frankly, is really where I stand now. I stand with humanity. How about that? That's my position. I'm in the humanity party. Can we see light without dark? I don't know. I don't know. Maybe we could see less dark. That's probably one thing I could help with, is we could watch less dark. But nonetheless, here we are. And I feel like my eyes were opened in a couple of ways today, because I think Medicare and Medicaid are very, very important to me, to all of my family, to the world, or to the nation, certainly. And so healthcare is incredibly important. And so it does behoove us to know what the fuck is going on and who's doing what. So appreciate everyone and all the great information and discussion today. I will be back tonight. Whoa. I'm going to see you tonight. Oh. That's right. I'm going to see you tonight. And so, yeah, enjoy the cool intro outro that I made. All right. I'll see you later.